My topic is about mental health and substance abuse. I chose this topic because mental health and substance abuse is one of the country's largest health issues. It's very overlooked in society and comes with a lot of its own stigmatisms. Most people are too afraid or not sure of what kind of resources are available in order for them to get treatment. We also, unfortunately, have lots of insurance problems in this country that cause even more people not able to get the help that they need. The demographic affects pretty much anyone and from any walk of life and any age group. However, the use of substance and mental health illness was higher in multiracial adults than among any others. This led by 46% of the age range of 18 to... Background: why it is important that public health issue is addressed. If these issues are addressed and action taken to prevent/help decrease the amount of people that are addicted to medications, there would be a drastic change in the amount of homelessness on mental health issues that plague the world today. Which this is just meaning if we can fix a lot of mental health issues and lower depression levels, we could even possibly help addiction levels decrease, and we won't have so much homelessness and sickness and disease spreading. Here are some charts here that I had found, which show how we have 2 in 5 people who struggle with mental illnesses that also struggle with drugs. 3 in 4 struggle with alcohol. 1 in 9 struggled with illicit drugs and alcohol use. 1 in 4 had serious mental health issues. The people who get treatment. There are many effective treatments for both mental and substance use disorders. A comprehensive treatment approach will address both disorders at the same time. Not everyone with co-occurring conditions gets the treatment they need. And you can see here a chart of that percentage. Some campaigns and programs that I had found that work great with the mission that I am trying to promote. The Substance Abuse and Mental Health Services Administration. It's one of the biggest organizations involved with these issues. Their mission statement is to lead public health that promotes mental health and the importance of substance misuse and provide treatments and support systems for struggling individuals. There's also the Heron Project, dedicated to helping individuals who suffer from addiction. The Heron Project is a non-profit formed by a former professional basketball player, Chris Herren, in 2011. Chris Herren has need in long-term recovery since August 1st of 2008. Future trends if this health issue is not addressed. What will be the consequences and why? I read an article called Homeless Youth and Young Adults in Los Angeles, Prevalence of Mental Health Problems and the Relationship Between Mental Health and Substance Abuse Disorders. It links how depression and abuse can lead to mental health disorders, which many young adults are afraid of admitting they may have, which will then lead them to self-medicate and become addicted to drugs. After a while, this can lead to homelessness and make it far more difficult for them to get help. Another article, Hospital Readmission Rates and Emergency Department Visits for Mental Health and Substance Abuse Conditions, goes into detail how if someone is addicted to a substance related to mental health issues, they have a higher chance to be readmitted within 12 months to the ER for treatment of overdose. Interventions. I believe starting out with these 3 interventions will help: knowledge, hospital programs, prevention. Nobody knows how to get help. The first initiative to be taken would be spreading the knowledge. Speaking on college campuses would be a great way to target younger demographics. Hospital programs, a more final solution would be to find help and create a fund at local hospitals that can care for patients struggling with mental health or substance abuse problems by treating them pro bono or fixed income rate. And lastly, prevention, promoting free counseling and safe places for meetings so that the chance of becoming homelessness or relapsing greatly decreases. Some goals and objectives to be achieved would be creating safe places, low cost, free medical care, knowledge and resources, and again, prevention being the number 1. Who is currently making this happen? Here are some local programs that I have thought that would be great. As a good starting point, Erlanger, UTC, local churches, and of course, Chattanooga Recovery Center. How we get there? Helping others, volunteering. The key takeaways are understanding that just because an individual is abusing substances doesn't make them a druggie. We need to stray away from the negative stigmas. Knowing the resources that are available to help you or someone you may know, it's okay to always ask for help. This is important because it may not affect you now, but it could in the future. Someone you care about may struggle, and you might find yourself having to help them find the help that they need.